Right, Don, thanks. We're in the midst of virus season, and Western Mass News wanted to know what what they're seeing so far this fall. And Western Mass News reporter Reagan Locree joins us live in studio after getting answers. So, Reagan, what did you find out in terms of cases so far this year?
Yeah, Chris, I checked in with 2 doctors today to see how flu cases were looking, and they both said as of right now, they're more concerned about RSV. Last winter, we saw a triple whammy of COVID, flu, and RSV cases all peaking at the same time. And Dr. John Kelly of Redwood Pediatrics tells Western Mass News from now on that's going to be a concern every year.
Back in the day before COVID pandemic, it was a double whammy, right? We always worried about RSV and flu. Now we've added another respiratory virus to the milieu.
And Dr. Armando Paez, chief of the Division of Infectious Diseases at Bay State Medical Center, says it's difficult to predict what they're going to see each year, since there are now 3 serious respiratory viruses to worry about.
We can all peak at the same time too.
However, both doctors tell Western Mass News as of right now, the big concern is RSV. Dr. Paez says so far the hospital has only seen 2 positive flu cases. However, this week their labs have seen over 3 times more RSV cases than the previous week. He adds COVID cases peaked last month, but they've gone down about 50%. Dr. Paez says these numbers are low compared to last year. However, it's too early to say how it will play out, especially since last winter they had a huge surge of RSV cases in November. But the good news is now there is a vaccine for those ages 65 and older.
Based on obviously on the clinical trials and in terms of getting the RSV vaccines approved, it's 83 to 89% for older adults to prevent complications for RSV.
And another at-risk group also has a fighting chance. Doctors are also starting to roll out a vaccine for babies under 8 months old. And Dr. Kelly tells us his office is ordering the shots and should be able to start vaccinating patients very soon. He says studies show this vaccine could reduce infant hospitalizations by 80%.
That's huge. That is a game changer.
Dr. Kelly adds this RSV vaccine for infants is one and done for the season and will give babies protection for up to 5 months. Now, both doctors I spoke to encourage everyone to get vaccinated for COVID-19, the flu, and if you're eligible, RSV as well, in order to better protect yourself and the community. Reporting live in studio, Reagan Locree for Western Mass News.